Hello everybody, I hope this finds you well. I'm Heather Knox, Chief Executive here in NHS Lanarkshire, and this is my weekly video that I do for all staff to keep people up to date. Mainly it's been introduced during COVID, so we always do talk about the COVID numbers, but I've been using it to update staff around other things as well. So today I just want to start by talking about the NHS Board meeting that was held yesterday, where the Board considered a range of proposals to support general surgical provision across the 3 sites within Lanarkshire. There have been issues with service sustainability on the Monkland site recently, largely due to consultant vacancies, and that has led us to think about how we can manage general surgery services differently and provide a safe training environment for our students and our junior doctors. And that in turn has led us to think about 2 big teams across NHS Lanarkshire, and that's the model that we're moving forward with in terms of service sustainability from August. We've also agreed at the board yesterday that we will do a further options appraisal piece of work to look at general surgery over the next 18 to 24 months. It was a piece of work that we'd started prior to COVID, but obviously it had to be paused as we dealt with the pandemic. So we're keen to look at how general surgery can be best provided across Lanarkshire for the future as part of Our Health Together. So it's just to signal that. I also want to say thank you to all of the staff who have worked together to support the Monkland site with the issues around their vacancies and the issues around their junior doctors provision, because it was quite difficult to provide that service with all the gaps, and actually the staff, the general surgical staff from both Hare Myers and Wishaw have been fantastic in working together to provide that service across the 3 sites over recent months. And the reason that we've moved to 2 big teams is we think it'll be easier to recruit, and we will obviously want to have a more sustainable service going forward. So we think that that will work as a model, and we'll have to wait and see how that moves forward, but I'll keep you up to date with that as we move over the next few months. Secondly, just to update you around the COVID numbers, unfortunately we are, as I said last week, now in a further wave. Our 7-day average of new cases is 325, but the number in the community is probably as high as about 1 in 18 at the moment in Lanarkshire, so that's a lot of people, and I'm sure you will all know people with COVID at the moment. We have 141 inpatients, so it is still causing patients to be admitted. We had about 4 people in ICU last week, and that's now gone down to 2. We have 15 care home outbreaks today. So I would just say, be careful and think about risk. If you can be outside, please try and meet people outside. It's really easy to catch this particular variant, so take care, look after yourselves. If you're in an inside environment such as shops, I would still wear your masks. It's very, very easy to catch this inside in particular, so just take care and assess the risk of different situations. So if you are going into a social situation, maybe you're going to celebrate something with friends, maybe just stick in one group rather than socialising with lots of groups at the event. Things like that can make a real difference in terms of transmission of this horrible disease. Finally, I wanted just to mention Tiny Lives. We've just finished screening the last few episodes of Tiny Lives, and it's a lot of work that goes into that from our maternity team and neonatal. And I saw a really nice piece that Cheryl Clark had done on Facebook, actually, just saying thank you to the broadcasters, to our staff, but most importantly to those families who were open enough to share their personal journeys with the crews, and I think that always is what makes the stories behind Tiny Lives. So I just want to add my thanks to that, and thank you again everybody who took part in that. Thank you.